Hey there, don't you love my fancy schmancy getup? Well, I am a dental hygienist, and a lot of my patients, especially my elderly patients, my senior patients who have heart conditions or diabetes, lung problems, things like that, they have all been very concerned about whether or not it is safe to go back to the dentist during a pandemic. Okay, for me, I think I'm less safe than you, the general populace, because your face is right here in front of me. But we're taking a lot of precautions in the dental world. We already did that to begin with, but now with the pandemic, we're doing even more. So stay tuned and you'll hear the answer to, is it safe to go back to the dentist, next. Hi, it's Robin with SeniorSafetyAdvice.com. Tune in to us every Friday when we release a new video on topics about aging in place safely. So, as I said in the opening, I'm a dental hygienist. I've been practicing for 23 years. I started out back in the HIV/AIDS day. I was not a hygienist at that point, but I did actually work in the dentist office as a receptionist, and so I know the protocols that we've had in place for decades. So the dentist was already generally a pretty safe place for you to go. But then you throw in the coronavirus pandemic. Even though it is safer, it is still, you have to worry about it. If you are a senior who, again, has health complications, even if you're not, if you're just somebody who's in their 30s, you still need to be cautious about whether you're going to go out, where you're going, how are you dressing, are you wearing a mask? So what I want to do is take you on a little tour of my office. I took some pictures earlier this week, and we're going to look at the different things that my particular office has done to make it safer for people to come back during the pandemic, and also the things that you should be looking for in the dental office that you go to so that you can be sure of whether or not it is safe for you to go back. So I have to say right from the beginning, we were shut down for 3 months from the middle of March until the middle of June. When we went back to work, I have honestly been astonished. We've had a full schedule almost every day. In my particular office, there are 4 hygienists, and that means that we're seeing between the 4 of us 32 to 40 people in a week. And let me tell you, that schedule is not empty. There are very few empty spots. So that's good on the one hand because it means that people have confidence in our office. But things that you should be looking out for are things that you maybe would have overlooked before, but really need to pay attention to now. The first thing that I can think of is Esther, who is the other half of the Senior Safety Advice duo, went back to her dentist not long after everything started opening up and you could go for non-essential services. The first thing that happened to her is in walking back to the back of the office to have treatment, they told her it was a mask-free zone and that she didn't need to wear the mask that she was wearing when she was in there. Now, granted, I cannot clean your teeth when you have a mask on. As I tell my patients, I haven't quite perfected being able to clean through your ear, so you do have to take it off. But your dentist, your hygienist, any staff member in that office, and the patients that are also in that office should all be wearing a mask anytime they're in any common area. This means in the hallways, in the reception area, if they're checking out at the front desk, in all those places, restrooms, they should have a mask on. You don't want to pass somebody in a hallway. I know our particular hallway, it's wide enough for 2 people, but that's not allowing for a 6-foot social distancing. So do be prepared to wear a mask anytime that you are not being worked on. So the next thing to look out for is, have they put up barriers in between you and the people at the front desk when you're being checked in or when you're being checked out. These are similar to what you have in a cash register, in a grocery store kind of a thing, or in a regular store. There should be a barrier. We have barriers on ours, and you have to, for me, it's kind of weird because I always want to kind of look around that barrier. Even though it's clear, I feel like I need to get around it. So look for barriers. So masks on everybody, barriers. The next thing that our office has done, and the ADA and the CDC recommend, is that you be screened, fill out a COVID screening, or at least be asked COVID questions before you are allowed to be treated. So those questions, are you running a fever? Do you have a cough? Have you been exposed to anybody who has COVID recently? Have you traveled and maybe gotten an exposure? For an example, we had a patient who came in all ready for his cleaning, and then we found out his girlfriend had been exposed. So we asked him to reschedule. So ask your office before you go in, before you confirm your appointment, if they are completing a COVID screening. The next thing that they should be doing is taking your temperature. Now, we've got one of those temperature guns, as you can see in the picture here. It's non-invasive. You hold it up against the forehead or the back of the neck. I have a little problem with those. In my experience, they run a couple of degrees lower than what the actual temperature is. But at least the temperature is being checked. So if your office has one like that, which most all offices do have, I believe, at least if the person's temperature is 99, we know they're on that border of potentially having a fever. We would ask them in our office to please reschedule until their temperature was lower. So after filling out the COVID screening and having your temperature taken, then you need to wait for your appointment. So in our office, we are telling patients if they would like to wait in the reception area, that is fine. We've removed some of the chairs so that there's social distancing happening in the office. We also have taken out our magazines. So your office should have the magazines removed, because if I read it and put it down and I happen to have coughed in my hand and now you pick up the magazine after I touched it after coughing, you are exposed. So those should be gone. So even if they're not gone, if you go to your dentist, don't touch them. The next thing is in our office, we have a large HEPA filter, as you can see in this picture, in our reception area. So that is exchanging the air in the room several times in an hour, which helps to keep the virus down. We're also letting our patients know that if they feel more comfortable waiting in their car until we're ready for them, they are more than welcome to do so. They just need to let us know that they're in the parking lot, and then we'll call them to come in when we're ready. So that is an option for you. If you feel uncomfortable in the office, please let your office know that you will be waiting in the car, and they can call you when they're ready. They should have no problem with that. That is also part of ADA's recommendations, so they should be very familiar. So speaking of HEPA filters, in our office, in each of our rooms, we have a smaller HEPA filter on the floor next to the chair. So the reason that we have this is, again, it's exchanging the air in the room several times in an hour, and any aerosols that are generated during the procedure from the patient laughing or talking or anything that I'm doing, polishing, whatever, cleaning, those aerosols are being drawn down to the floor by that HEPA filter and exchanged through the filter, and clean air is being put out. And so, of course, your environment is much safer, and that's something that you want to have in your office as well. So the other thing that we've done is our rooms happen to open up between the rooms. So in order to limit the exposure of the air moving through the office, my dentist boss has put up barriers in between each of these rooms. So if you go to an office that is open like that, you may also want to look for the barriers. They're not a necessity, but it's a nicety. So, and then, of course, you've seen now everybody's wearing masks. Hopefully, everybody's wearing masks. And also, a lot of people are wearing the face shields. Here I am in mine, in all my wonderful garb. But you would want your dental hygienist, assistant, and dentist, anybody who's going to be working very closely with you, you want them to be wearing a face shield as well. And they should also be wearing goggles. The goggles and mask were a standard before we ever had a pandemic, but in adding the face shield, it's just another measure of safety for you. So also, as we've always done, we have our sterilizers running, so the instruments that we're treating you with are only for you. They have been put through the sterilizer. They're safe to be used just like they always have been. In my case, I put my instruments out, set up my tray, and then I cover it with a napkin just to make sure that anything that may be in the air isn't falling on the tray while I'm waiting for somebody else to come in, for the next patient to come in. Again, that's not a must, but it's just something to look for. It means that your office that you go to is concerned about your safety as well as their own. So we are also using the strongest disinfectants that we possibly can. And we're using those, of course, we always did that in between every patient in any case. But you want to be sure that your office is using disinfectants, is barriering up on the light switches or the handles of the lights, putting a chair cover on. If there are machines that are being used, they should be used minimally, so expect that if you normally are getting the sandblasting, which is done by the baking soda spray, you probably will not have that done. We are not using that at all in our office because it generates too many aerosols. The other thing that we're limiting, very, very minimal use, is our ultrasonic equipment, because again, that is something that generates a lot of aerosols. And so that's being reserved strictly for patients that have gum disease, that need to have that equipment used in order to get in and clean out and make sure that everything is healthy. But for a normal patient who is healthy, we are not using that. So if you had that used in the past, expect that it probably will not be used on you until after the pandemic is over. Lastly, hand sanitizer should be everywhere. Again, in our office, and ADA protocol, CDC protocol, you should, in the office, we should be wiping down the doorknobs, the pens, the countertops, the bathroom. All of that should be wiped down at least once an hour. And that's something that we do at least once an hour in our office, sometimes more frequently if we've had, at the beginning of the hour, you have a lot of people coming in, or at the end of the hour, you have a lot of people leaving. And so a lot of times they're wiping it down much more frequently than that. But you do want to check and be sure that there's hand sanitizer available and that your office is also wiping things down. So there you have it. Is it safe to go back to the dentist? In general, yes, it is, assuming that the precautions that I've listed have been taken. There are other things that can be done. They're even a higher level, but the things that we're doing in our office and the things I've told you to look for are the things that the CDC and the ADA recommend. So as long as your office is following these procedures and you wear your mask and stay away from other patients, socially distancing, you should be fine to go back to the dentist office. The thing about it is, if you're able to and your office is open, it's probably a good idea to go. You don't necessarily have to. It's probably not going to be a big deal if you wait for a year. But the problem is we don't know how long this pandemic is going to last. So as a hygienist, I hate to see you go maybe 2 years without getting your teeth clean. So again, it may be something that's good for you to do at this point when, we haven't hit that second wave. We're not trying to clean your teeth in the middle of cold and flu season. This may be a better time. So thank you for watching. I hope this helps you feel a little bit safer when the time comes for your next dentist appointment. If you liked the video, give it a thumbs up. If you haven't subscribed to our channel yet, hit that subscription button down in the corner and also hit the notification bell that pops up, and that way you'll get notified every Friday when we put out a new video. So until next time, take precautions. Floss your teeth every single day, because that way if you don't go to the dentist, at least you're doing what you can to stay healthy. Wear your mask. Stay safe. See you next time. Bye.